Good afternoon, North Dakota. Happy Friday.
KX News special report.
Today is Arbor Day, and we've issued a proclamation May 1st, 2020. Some of you may think that Arbor Day was last week, April 24th, because it is other places in the country, but North Dakota officially falls on the first Friday in the month of May. That happens to be today on the 1st, so the first Friday of every May. And it reminds us about the important role trees play in our lives. And of course, that week later, spring comes a little later in North Dakota than other parts of the country. But we know that trees make direct and visible contributions to our health, our safety, and our economy by providing clean air and water, wind protection, erosion control, wildlife habitat, recreational opportunities, essential wood products, and beauty. And of course, they instill pride in communities. They work as living snow fences. They screen unpleasant sites. I didn't know we had any of those in North Dakota. But they increase property values, of course, and they memorialize significant events. And as we enter today on this historic day, as the beginning of reopening high contact businesses in North Dakota as we go through this historic pandemic, I hope that one family activity that people may take this weekend as they consider the Arbor Day is to think about planting a tree, maybe in honor of your family, maybe in honor of a loved one, that would help you remember this historic time. And of course, North Dakota is the land of the Great Plains. The definition of plains is prairie. So many of the trees in North Dakota have been planted either by North Dakotans or by our ancestors. And many of them were planted a long time ago, and a lot of them needed new replanting, so we'd love to see more trees planted in North Dakota. You can be a part of that, and this is the right time to think about it. So anyway, happy Arbor Day, North Dakota. We have a big schedule today, in addition to our normal update on the numbers and the virus. Superintendent Baszler is going to be here to talk about K-12. We're going to have more in-depth reports from our two leaders in both testing and contact tracing, Brigadier General Robert Schulte and Vern Dosch. Thank you, gentlemen, for being here today. We are pleased to have you here. I see General Dorman also here if we need to call on him. We also want to thank Mylyn Tufte's here and with a group of folks from the CDC. They're all doing an excellent job on spacing and looking great in their masks. And so thank you, CDC, for your great work. Thank you for being here. Thanks for helping guide us through this. And I also, in addition to that, we've got an update on Vision Zero, which of course is our vision for having zero traffic deaths in North Dakota, behavioral health update as we've had every day, and unemployment stats, and then closing with some gratitude. Okay, let me jump into the numbers. This afternoon, the North Dakota Department of Health confirmed an additional 40 cases of the novel coronavirus disease, or COVID-19, out of a record 2,065 tests. Well, this is 6 more cases than yesterday's 34. It is the first time we've completed more than 2,000 tests. At our today's test rate, 1.9%. Again, that's among the lowest in the nation. And so we like that number for sure. And of course, that's the 40 divided by the 2,065. Our cumulative positive rate going back to the very, very beginning of this, our first case on March 11th, 1,107 total cases now divided by nearly 30,000 cases. That's how we get that 3.7%. And again, that's among the lowest in the nation. With this great testing effort, the 2,065 tests, again, I want to give a shout out to all the folks involved in testing, whether that's providers, taking inbound demand from people who are symptomatic, or our team that's getting out and doing the community outbound testing. North Dakota has risen to 4th in the nation in per capita testing. Only ahead of us now are Rhode Island, New York, and Massachusetts, which are 3 states that have been part of the epicenter and have received enormous amount of federal help on testing. But we've moved up the leaderboard from 10th in a few weeks ago to number 4. We've now passed Louisiana, which is another big outbreak state. So we are the highest in the nation of a state that has not had a major outbreak. And we're actually Lieutenant Governor Brent Sanford, who, as you all know, is fabulous with numbers, always digging in. We're closing in on a per test per per 100,000 rate that we're in the chasing countries like Estonia and Iceland, who's been in the news for having the highest amount of testing. You've heard a lot of stories about the great job of testing that's going on in South Korea. North Dakota has now done more tests per capita than South Korea did. So great work by our testing team. At that 3.7%, that is the 5th lowest rate in the country, again behind only Alaska, Hawaii, West Virginia, and Montana, and that number continues to drop. Going to the net case breakdown on the next slide, which we really like to focus on again because it's not the cumulative number that is important for us to manage, it's the number of active confirmed cases, which is now 602. This increases 12 from yesterday. This is the net of the new 40 cases plus the recoveries. Hospitalizations are down by 3. And again, we've got some sad news because we are reporting today 4 deaths. This has been, I'd say, I won't say inaccurately because we are reporting them today, but it would be inaccurate to call them a single day deaths because there was some reporting lag related to the timing of when these individuals passed and when the data was reported. Another one of the positives from a mortality came posthumously, meaning it was a test after the person had passed away. And so on these tests related to this, one of them occurred several days ago. April 26th was one of the 4. 2 others died on April 29th, and only one of the 4 occurred yesterday on April 30th. And so again, it was 1, 2, and 1 versus 4 in one day. But again, we're reporting them all today because for the delay in reporting as I just described. But regardless of what day it was, whether it was the 26th, the 29th, or the 30th, we still know that regardless of age or circumstances, always difficult and sad to lose a grandparent or parent. And we extend, the First Lady and I, our hearts go out to the loved ones of those who have lost individuals to COVID-19 during this pandemic. Of the 4 that passed away, one was a man in his 90s from Cass County, a woman in her 90s from Cass County, a woman in her 80s from Cass County, and a man in his 70s from Cass County. All had underlying health conditions. The next slide we want to take a look at is the North Dakota case trends. And again, when we take a look at these, we see that we have a continued more record number of people who have recovered, a slight increase in the number of actives up at the top, but relatively flat as we bounce along the top of that curve. And of course, we expect that we'll see more recoveries as the days pass and go forward. When we take a look at our continued decline in the positive rate over the 14 days, this is one we know the whole state's been watching. This is part of one of the White House's gating factors related to the rolling 14 days. So this is all the positives and all the tests taken over the last 14 days. We didn't really ever have much of you couldn't call this a surge, you couldn't call it a peak. This is it is quite flat. If this is on a larger scale, it would really look like a straight line because we've gone basically between 5.3 up to 6.4 and then back down to 5.0. The good news is this is going down, but this is continues to decline through the week, and we're happy to see the directions going. And the reason why it's going that direction, of course, in North Dakota relates to North Dakota SMART guidelines, which we've had out and all of you are following. We know that we've had very limited government mandates and very high individual responsibility and some fantastic performances by business owners, by faith-based leaders, by our manufacturers, by others doing a great job that have remained open during this time and worked on protecting themselves and their team members. And as we move towards the reopening for the high contact businesses today, again, as we said yesterday, we know that everyone will be out there practicing good COVID etiquette, including customers, because the customers that are coming back, you play an important role in supporting those folks that work in high contact businesses. So thank you all for that. I have had people send me photos from this morning of them getting their long awaited haircut while wearing a mask. So we know that there are customers practicing good etiquette. Thank you to you that are out there doing that already today. The next, I want to interject some gratitude before we go to the next topic. And the next topic is K-12, and I want to start with real gratitude to everybody involved in K-12. I get in the middle emotional thinking about it because this is at such scale, it's hard to really understand. It's one thing to think about, gee, you close schools for a storm day, that's one thing. Something the North Dakotans know about, but then we'd say, hey, well, the storm's over, let's open back up again. That's probably the metaphor that we all think of. But here at the scale, just to understand this, there's 113,000 students in public schools, almost another 7,000 that go to our private, parochial schools in North Dakota, and so 120,000. We've got about 12,000 teachers and 1,000 administrators that go into those buildings every day. So we're talking about 133,000 folks that are doing that. And unlike other states that have closed down for the year and there was not much education going on, our K-12 system, from school board members to parents to teachers to administrators, responded in a way that I think if someone had said theoretically in February, hey, I've got an idea, let's close down all the schools, no student can go into a school building, and we'll go switch to all distance learning, and we'll do that on a couple weeks' notice, people would have said, hey, that's impossible, that'll never happen. And what we have seen here is we've seen that in the state of North Dakota, whether it's our heroic frontline healthcare workers, whether it's people at the state lab, whether it's the National Guard, whether it's our universities, and especially our K-12, people have stepped up and have done the impossible. And in this case, really incredible. The fact that we've kept distance learning going, and we know that it's there's been hundreds and thousands of success stories that have gone on across this. Again, on the scale, 373 public and 57 non-public school buildings have been closed since March 19th when we extended the order. The original order was on March 15th when we ordered to close schools to on-site instruction. They've always been open to administrators and faculty. I want to point out that on this journey that we've been on, it starts out with gratitude for all of you to allow us to do distance learning. People might say, why did North Dakota have such low incidence of cases? And we say, and there have been articles saying, well, schools should be the first one that go back. And I understand that people have that opinion because they feel that young children do not have as much susceptibility, certainly in terms of mortality, to this disease. But in our little state, if we take a look at where and how people congregate, there's nothing that puts more people together in closer spaces for more hours of a day than our K-12 school system. And so that was why when we first identified the first COVID case in North Dakota on March 11th, that was a Wednesday, the students were in school that Thursday. That Friday was spring break for many. That Sunday we announced closures. So literally it was either after one day of school or after 2 days of school after the first positive case, we closed schools for the physical school buildings for student use at that time. 2 days after the first positive is among the fastest action taken by any state in the nation, and certainly I believe it's part of the success that we've had in really never having a surge or outbreak here. I've talked about the numbers of all of the folks that we have, here in the closure. And again, I want to say again, we had great collaboration from our tribal partners because our executive orders did not relate to the 541 students that attend Bureau of Indian Education schools in our state, or as well, but those tribal leaders often worked in close concert with us in taking the same action to protect their teachers and their students and their families. As of today, we've only had 46 confirmed cases in the 0 to 9-year-old range, 54 cases in the 10 to 19-year-old range. Some people still think if you're under 20, you can't get this. That's 100 out of our over 1,100 cases are related to the cumulative cases that are related to people under the age of 20. Fortunately, we've only had a couple of people in those age groups, one under 10 and one under 20, who've been hospitalized. But you know, 100 people have had it, 2 have been hospitalized. When we think about schools being hotspots waiting to erupt, and you think about buses, you think about gym class, think about cafeteria, classrooms, think about staff and staff breakout rooms, think about vulnerable staff, think about staff that have, that may have underlying health conditions, think about students that have underlying health conditions. And when we think about tracing, and we talk about contact tracing, you'll hear more of that later. In North Dakota right now, when we contact someone who's been positive and do the interviews, on average it's between 5 to 7 people that they have had close contact with that when we follow up with. Imagine that you're a junior in high school and you became ill and you went to school, and that your close contacts might be everybody in your class, everybody in gym class, everybody in choir, everybody in band, everybody on the track team. We could have been in situations where with even a few cases that we would have had hundreds and hundreds and hundreds of those. And when those cases happen, as around other states, when they had breakouts, then schools had to be closed for cleaning. And again, it becomes kind of a cascading set of challenges. So I want to say, as we understood the risks, that's why we went to quick and early closure. And North Dakota has been a shining example of distance learning. In addition to that, I want to credit the schools for keeping going on their nutrition mission as well as their special ed mission during this time. And they've continued to educate students across the state through creative combinations of online instruction and effective use of good old-fashioned books and book reports and homework. And of course, parents have been a key part of this, and so we want to thank the parents for their important role in this. So with this, we're announcing today that we're going to continue with school distance learning for the rest of the year. This is a decision to remain with distance learning was made after much deliberation. As you can see that with the size and scale of this, we're talking about over 135,000 people that would be affected directly every day, and that doesn't count family members and parents, because parents of school kids work in nursing homes, parents of and grandparents of kids that go to school are part of that 20% of North Dakota vulnerable population. And so we had tremendous input. We worked in side by side, step by step with superintendent and DPI, the North Dakota Department of Health, its physician advisory board, school administrators, the teachers union, school board members, legislators, parents, and students all provided input into this decision. And of course, it's certainly an emotional decision to make, particularly given how emotionally connected we are to our schools and our communities and our teams. But we know that, again, that reopening for this short period of time, it would have required at least a week of planning. And we've gone through the analysis. There is a set of our schools in North Dakota, their last day is May 13th. Others are done on May 20th. Others are done on Memorial Day, depending on the school week. So there's a sort of cohort of some schools that had 1 week left, 2 weeks left, or 3 weeks left. I'm not so old that I can't remember what my last few days of school like were in the spring, or what my kids' last days of school, but there was a lot of celebration and fun and movies and turn your books in. So we know that those final few days of school weren't probably the highest learning days of the year. And so again, the risk associated with bringing everybody back in terms of potential outbreaks, including in communities where maybe we haven't been hotspots, and then could become one, because the school interaction could really, it's about not only protecting the students, but protecting the whole community and the number of communities that also have long-term care and other facilities. We're thinking about the whole ecosystem here. The other thing we're also thinking about is capacity. You've heard us talk about when in the reopenings today relate to our ability to manage risk. It's not that the virus has gone away. It's not that it's still not contagious. It's not that it still isn't deadly to people with underlying health conditions. But we have been able to reduce risk by building the capacity around testing and contact tracing and targeted isolation. In the same thing, when we think to next fall, we know that there is going to be an opportunity for us to have even stronger and better capability in terms of protecting our most vulnerable, being ready to manage the potential and perhaps inevitable outbreaks that may occur in schools, and that's going to be really helpful. So we think that in terms of the risk right now relative to a few weeks of school versus spending that time building our capability, because if we opened in the next 2 weeks and we had outbreaks in school, we would be taking our capacity for testing and contact tracing away from those most vulnerable, and we would be applying it perhaps to those that are less vulnerable. And again, during this capacity building time, we've got to manage risk. And so this is opening up businesses also involved risk, but there is economic risk to leaving them closed. Through distance learning, all teachers and administrators are all still being paid, and the funding is in place, and so there is almost no economic risk to the state of North Dakota to continue with distance learning. And so again, that was another factor that fed into this. And lastly, there's also limited capacity for teachers, administrators to keep planning and build contingency plans. And if we had decided to reopen for the last couple weeks of school, this would have put an enormous burden on our 175 school boards. Undoubtedly, it would have been there would have been local control on whether they reopen or how they reopen. And I could envision that there would have been weeks of school board meetings followed by angst from parents about is it safe to send my child back in, and teachers wondering if it was safe for them to go back into the building. We're much better taking that energy of those school boards and those administrators and those teachers to say, how can we focus on making the distance learning experience as productive and as productive and as positive as we can for those students for these last remaining days. It also is going to free up capacity planning for those administrators and school boards and teachers to plan for summer programs and to focus on gaps for those special needs of students who maybe either lack the skills, the tools, or the access to be able to participate fully in distant learning. It's going to allow time to plan to resume in-person classroom instruction for next fall, because we know that there's no replacement for face-to-face learning between teachers and students, and I know that everybody will be excited to get back to school next fall. It also gives us a chance to, instead of spending time on focusing on all the health issues associated with reopening, to focus on how we can do a better job of distance learning related to technology. People can identify technology upgrades and they can find out what's worked. We've now, over about 20 days into distance learning with 120,000 students in North Dakota, think of that. That's 2.4 million student days of distance learning that's gone on. We certainly know more now about what works, what doesn't work, and where we need to make improvements. And so in conclusion on this, I want to just say the last point about this is with this decision. We know that this decision also brings comfort to school administrators, school boards, teachers, and parents, because it provides certainty. People were concerned about, planning or trips or spring or graduation parties, or what if my kids go back into school, and what about this or childcare or that. One of the things we know that even in the middle of chaos, certainty can help families plan, and so by providing the certainty that we're sticking with distance learning through the end of the year, we hope will help people be able to make decisions. The other thing that I also know that is certain, that out of chaos and disruption becomes an opportunity for innovation and vision. And we know that we began this journey some time ago. There was a Senate bill that was passed a few years ago by our legislation that allowed schools to file innovation plans. It was Senate Bill 2186, Innovation Education Bill. These allowed schools to focus on individualized learning. And we have an opportunity now, we've seen it work in the schools that are doing this best, the distance learning, that they can really be focused on learner-centric education. This is an opportunity for us to best practices, collaborative action, continuous improvement, and choice-ready education. When we take a look at the 14 months work of that task force, which included administrators and teachers and private sector individuals, one of the things that really came through was flexibility on graduation requirements to provide personalized learning pathways. We know a number of schools have done this. Holistic student support that recognizes the increasing behavioral health challenges facing students today. Innovation toolkits, wraparound supports, innovative incentive funding for teacher leadership to compensate teachers who go above and beyond. And districts also working to identify the key data metrics to ensure that we're measuring progress across the state. This has been super valuable. The schools that were on the front edge of these innovation plans, and any school in the state has an opportunity still, this legislation is there to create and file one of these plans. To do that, those schools that had done that allowed them to more seamlessly move into this education because they were already doing individualized, personalized learning as opposed to trying to move everybody along at the same pace in one classroom. And so, again, we applaud those innovators, and we know that they'll provide inspiration as we move forward. But the other thing for the legislature and others to think about in terms of innovation is we know that distance learning with the pandemic should be used to evaluate a number of things about how we think about schools and school funding and school buildings, but also things like reevaluating attendance and absence policies. We know that right now, if a student is home sick, more than ever, when we head into next fall, if they're sick, we will need them to stay home when they're sick. And we need to make sure that they can continue to receive instruction at their home if they're not able to attend or while they're recovering, and to not have absences on their record or not have absences affect a school's funding. Or when we have storm days, perhaps those can be automatically become distance learning days. But anyway, there's a big opportunity here to improve coming out of this, but I want to put this out as both a thank you to everybody involved in K-12 for the amazing work you're doing, and as we look ahead to summer school, new ideas like acceleration academies in August to help prepare kids to get back to school or getting back into our buildings next fall. I want to issue also the challenge to everybody to keep doing the amazing work. We've led the nation in moving to distance learning. Let's take that learning and figure out how, in a student-centric way, we can have North Dakota education be the best in the country. Next up, I'd like to invite Superintendent Basler. We're so grateful to have her leadership, her tireless leadership. I know if there's anybody that's in the building about as long as the governor's office team, it's the team up at DPI. So thank you, Superintendent Basler, and also for all of North Dakota, we're lucky to have someone who's been a teacher, been a building administrator, and been a school board president. Few in the nation get to have an elected leader with that kind of background. But thank you, Superintendent Basler, for the partnership. Thanks for being here today.
Thank you, Governor Burgum, and thank you for your leadership in this as well. I just want to say, the governor said it well, but this pandemic has caused, as it's an often overused word, but there really is no other word for it, an unprecedented disruption to our students and the traditional way that we deliver school. The full continuation of education has been North Dakota's priority from the first day and will continue to be. And very few states can say that. The full continuation of education did not stop when our school doors closed to our buildings. Record amounts of innovation and transformation in education have been produced during this time, and they were developed and planned for in a record matter of days. North Dakota has led the nation in demonstrating the agility and the effectiveness in moving rapidly across all of our districts, not just some of our districts, not just some that were poised, but all of our districts to deliver education with distance teaching and learning. During this uncertain and difficult time, we are heartened but not surprised by the dedication, focus, and resolve of all of our educators across this great state. They have planned for the distribution of food to their students and moved classes and whole districts online, and they have spent hours at home reaching out to their students and their students' families with educational resources and sometimes, oftentimes, offers of comfort. We are reminded of their wisdom and their strength that they bring to their work every day. Even in normal times, teaching is enormously complex and challenging work. But these teachers have entered the profession because of their empathy, their intellectual curiosity, and their motivation. And I also must remind everyone that during this difficult time, our families have taken on an entirely different role in their children's education in heroic ways. So I just need to share with everyone how proud and blessed I am to be surrounded by the educational community in North Dakota who are absolutely committed to our students, our families, and our communities. I wish that you, your families, and your students and communities good health as we continue to navigate our way through this journey. And I will take this opportunity to get a little jump start. Next week is Teacher Appreciation Week. Actually, next Tuesday is Teacher Appreciation Day. And I don't know that there is any better year than the year 2020 to reach out to all of the teachers, educators, as we say, from the crossing guards to our school nutrition specialists, to our bus drivers, all of those who play a role in education, and thank them. As the governor said, distance learning certainly is no substitute for face-to-face teaching, and we know that. And that really does underscore the importance of teachers and educators. But what we have demonstrated is that the core of teaching is building relationships. That's how your brain works. But relationships can, and they are, being built in a whole new, different way. And I'm excited about what we've learned during this opportunity and what we'll continue to learn, that we can transition and replicate as we move back into that face-to-face. Our students' families, they're in a rhythm right now. And one thing that I do know from those roles that the governor mentioned as a teacher, a building leader, and a district school board president is that certainty matters to our young people and security matters. As we think about transitioning, the fewer transitions that you can make a young person's mind go through, the more apt they are to learn. And so with that, I am supportive of the governor's decision. I appreciate the understanding that he has in what it takes to not only transition a building, a physical space, into readiness for students to enter into, but also the social, emotional, and academic needs of our young people as we continue the learning. With this announcement today, our teachers, our families, our students, our building leaders, our school board leaders are prepared now to continue that distance learning, the full continuation of learning that we committed to on April 1st, and we'll be able to end the year strong with that full continuation of learning. Our Department of Public Instruction, the amazing team that I'm blessed to work with at the department, have been working for the last several weeks in concert with the entities that Governor Burgum mentioned and Governor Burgum's office and the legislators as we prepare guidance to address the issues that must be addressed as we return to in-place learning and place-based teaching. And so with that, we will continue to work on that guidance and make sure that we are covering all aspects and all factors that must be decided to ensure that when our students come back to in-place, in-person teaching, that not only will they be safe, but those that teach them that will be safe, those that they return to at the end of the day will remain safe. And we will also address, our department is also working on the ever important question that I know comes to our office daily, if not hourly, about what about those all-important graduation ceremonies. The Department of Public Instruction and the Governor's Office know clearly how important that milestone ceremony is, and we are in the process of developing guidance for our school districts with the Governor's Office to address two opportunities. One, graduation ceremonies, how we might honor those seniors this year with the specific restrictions in place of no access to our school facilities, thinking innovatively like we have done throughout this, and also how we might be able to honor our seniors with graduation ceremonies possibly later into the summer when we would be practicing social distancing. So that guidance will be coming out on how our schools might honor our seniors, our graduates, with 2 different types of graduation ceremonies. And I look forward to working with the governor's office on that continued work for guidance. Thank you so much.
Thank you, Superintendent. And yes, I want to say it's not congratulations yet, but you're in the home stretch to those 8,000 seniors, and know that to those seniors, their parents and their grandparents, the superintendent and I are completely committed to trying to figure out a way to do the safest and healthiest possible graduation events that we can in North Dakota. And as Mike Nowatzki said, didn't want a headline saying that it's still up in the air on whether they'll be able to toss their hats on graduation day. So we want to make sure that we have that plan in place, and we're working hard on that. And we're going to take a look at everything, because we know it varies. If you're a small school district with 16 kids in your senior class, like I had in Arthur my first 16 years, that's very different than trying to manage an event for thousands of students in our larger school district. So we'll try to make something that works and is appropriate to size and scale and location across our state. But again, thank you, Superintendent, and thanks for being here today. Thanks for your partnership. Next up, we've got some great leaders that have come on board to help drive testing and contact tracing. You've seen that we're moving up on the leaderboard to number 4 in testing. We were listed as number 1 in the country in terms of capacity for contact tracing. So we've got a team that's leading North Dakota, but they're also, I like to say, leading the nation. First up is going to be Brigadier General Robert Schulte, and then he's going to introduce Vern Dosch right after that. Thank you both for being here, but General, come on up.
Thank you, Governor, for your great leadership. I'm just going to say, and Dr. Baszler, thanks. We have 2 children that have gone through the school system, and we're very fortunate with the public school system that we have in North Dakota. And again, to all the teachers and administrators, thank you. You make a difference. When Vern and I came on this project about a week ago, we knew this was going to be a challenge, but yet we looked at it as a great opportunity, and it's an opportunity to serve and basically take care of our backyard, take care of our neighbors, our family members, and our residents of North Dakota. And it's a challenge, but we have a lot of great opportunities to make a difference. The testing strategy team, when we came on board, was in great shape, and that's because of the leadership of our governor and certainly the state health department and General Alan Dorman. So we had a good foundation to work off of. The governor has said the testing strategy with this is to learn about the enemy. Okay, and with COVID-19, it's to identify where it is, it's to identify where it's been, and then try to get ahead of where it's going. And he said we'll work from a standpoint of facts and not fear, and that's the right approach. I think he said, and I think you've used this. You said this is the steering wheel, it's the compass, and it is the accelerator. And I'm going to put this in airman's terms. I'm an Air Force guy, so this is the flight controls, this is the aileron, and this is the throttle. So sorry about that. I just had to put it in airman's terms. But okay, very good. So let's talk about this as far as the testing strategy. Definitely widespread testing is how we learn and then how we can react. We definitely, to fight the COVID-19, we definitely want to find out who has the disease process and then get ahead of it. This is consistent with the President's plan to test 8 million U.S. citizens, and I think North Dakota is certainly doing our part with that strategy. Testing is definitely critical to find out who may be spreading the disease, and certainly with some of the asymptomatic carriers, it's very important that we identify that, and then from a containment standpoint, prevent. Controlling the spread of the pandemic is very important, and this comes into what my wingman, Vern Dosh, brings to the table with contact tracing. You can't have mass testing without having contact tracing, and his skills and abilities really set this up for success. When we take a look at our strategy and how we're going to approach this, it really comes down to our priorities. Our first priority is diagnostic testing, and this is ongoing. And a lot of thanks to all the healthcare providers out there, the docs that are taking care of their patients in their communities. But that's priority number one. Priority two is certainly the vulnerable persons. We're certainly looking at long-term care, congregate populations such as group homes, corrections, and then certainly our tribal neighbors. It's very important with that when you bring in long-term care is that we have a rapid response. And that's critical, and there's a great team that has been brought on. You guys know Chris Jones and the folks that he is leading with Dr. Stahl. We got 2 super nurses, without question. They wear masks, but I think I've seen them with some capes at times, and that's Roseanne Schmidt and Jan Campos. They're doing a great job with that priority of the vulnerable population, with the long-term care. And then we get into the mobile testing, and this is, from an operational standpoint, this has been remarkable to see what they're capable of as far as it's a joint team effort when we go out into these communities. It's a cooperation between our emergency operations, it's local public health, and then it's certainly the men and women, our airmen and soldiers that participate. But they've got this down to science. Vern and I had an opportunity to go to Fargo last week and see it in full operation, and it's impressive as far as what they're able to get through. Approximately 170 with 4 lanes in an hour, and it's well done. I want to talk a little bit too about capacity building and what goes into that. We get commonplace. I'm looking, and we start talking about 2,000 tests, and we keep ramping up 2,500, and it becomes commonplace as far as that capacity. But please remember, our state lab, the state processed approximately 195 tests prior to the COVID pandemic. And what they've been able to do is absolutely a team effort in regards to building that capacity. And it allows us to go out and test, do sentinel testing to identify, again, a little bit more about this enemy that we have, and to try to get ahead of it. There's a lot of people to thank on that, and I'm going to Major Jay Sheldon has really done a great job with this, but he's got a great co-team leaders with Department of Health and Department of Emergency Services with Amy Anton, Sherry Adams, and you've seen her several times, out and about and actually participating in every one of these mobile testing events. Julie Sickler and then Kelly Nagel. So a great effort by that team and everyone else that does that. What I want to bring up is just so you guys have some appreciation when you start talking about these numbers. There's a lot that goes into it, and there's a lot of effort from building that capacity as far as getting data input, as far as putting it into the systems, as far as building the kits, as far as getting the supplies, and this has been done by 24/7. These are folks that have come in to build these kits, and they take pride in it because when you're going through a contact, or when you're going through testing and in a mobile testing, everything's got to be there. Everything's got to be ready, and their quality control and their quality check has been exemplary. So a lot goes into making these oral and nasal pharyngeal kits, and all those. I met a young man the other night, and of course he's working the late shift, putting these kits together, and the pride. His attention to detail to get every one of these kits ready to go. We're going to get shipped out the next morning to a long-term care facility, as well as some of the mobile testing he understands. He makes a difference as far as being able to do the capacities. So yeah, we'll start talking, as the month goes on, we'll start talking capacities of 3,000. But every one of those kits that goes into it from the time we send them out to get them back. It's an extraordinary effort by many people. What I want to leave this with, and before I introduce Vern, is that testing, and when you take a look at the capacity that we're building with this goes hand in hand with contact tracing. And this is how we get ahead of this. But that's a challenge. The governor talked about for every positive, it's going to be on average about 6 contacts that the public health and our caseworkers have to contact. What he brings to this is a lot of the innovation and technology, and I'm going to just say game-changing technology that allows us to take on that kind of capacity and then do what we need to do with the contact tracing. So with that, I couldn't ask for a better wingman, and I'd like to introduce Vern Dosh.
Thank you, General Schulte. It's a real pleasure and a privilege to be serving with you. You know, when we started this journey of meeting the challenge of COVID-19 and keeping the citizens of North Dakota safe, our marching orders were pretty straightforward. The governor made no mistake about letting us know what his expectations were, and he would say, and he said it a number of times, he was consistent, and he would say, I want a robust, world-class contact tracing system. Those were our marching orders. And the team that I have the privilege of working with, we remind each other of that every single day as we go about that task. So our challenge is to reinvent the way we've done contact tracing in North Dakota. This is not new. This is not unique to COVID. Contact tracing has been used by public health for many years. It's a way of controlling infectious disease. But as General Schulte said, the scope of our challenge has changed a great deal. When we used to do 200 tests or 150 tests a day, and we had 10 contact tracers in North Dakota, the scope was very different, and we could do that fairly rudimentary by using fax machines and written forms, and we were able to get the job done doing that. But as you've heard the scope of what's happening at the state lab, going from 200 tests to 2,000 tests today, on to 3,000 and on to 4,000 this month, the scope has changed dramatically. The number of contact tracers that we used to have in the state was 10. And that was enough to meet the demand of tracing the amount of infectious disease that was going on. Today in contact tracing, we have 352 people, and that staff has been built within the last couple of weeks that are either actively in that role or are working to come up to speed through the training process. So we do contact tracing to protect the citizens. It's the very best way to stay in front of this vicious disease. But I'd like to talk just a little bit about the contact tracers. In my humble opinion, as I've observed this, they are the unsung heroes. We can talk a lot about technology and the infrastructure that we've stood up to support these contact tracers, but they are the unsung heroes, these 300 and some individuals. They are nurses, they are retired nurses, they are people that have come out of retirement to help this cause. And they are engaged, and they have had to acclimate to a brand new system. We call it D365, that is the system that tracks today about 2,500 active cases, active individuals that are being traced, that are in various stages of hopefully recovery. These are individuals, this is the human side of the numbers that you see every day. These are individuals that are making personal calls to these individuals that are working through COVID. personal calls, gathering information, counseling them, getting their temperature, trying to help them through this process of recovery. It's critical. And North Dakota, under Governor Burgum's direction, have been very aggressive with contact tracing. Frankly, you know, there are a lot of states where contact tracing just got out of hand. They didn't have the infrastructure, they didn't have the system, they didn't have the process, they didn't have the people to meet that demand of contact tracing, and they just gave up. They just threw up their hands and said, whatever, you know, I mean, I guess the disease will roll out as it will. And you've seen the results of that. You see it in the numbers that the governor presents every day. The importance of contact tracing, of staying hopefully just one step ahead of what's going on to take North Dakota citizens out of harm's way and protect them. That is our charge. The governor talks about facts, not fear. Contact tracing presents the facts so that we can make logical, factual decisions, not based on emotion or anything, but factual decisions, and that we can deploy scarce resources, testing kits to those areas where they are required to protect the citizens. So we are engaging powerful contemporary technology to do that. We have had to completely reinvent the way we look at and the systems we have, the infrastructure we have to handle this influx of COVID cases. We're making informed decisions, and that's the way it should be. We want to be strategic in how we're testing. We don't want to be using a shotgun approach. We want to meet the demands for the citizens who test. We want to be very strategic in where those testing resources are being devoted to make sure we take care of those outbreaks and those areas where strike forces are required. Last Friday, we turned up a system called D365. That is a brand new dynamics-based system that is a tool, a very important tool for our contact tracers. Gone are the fax machines. Gone are the written forms. These COVID tracers are online to a very powerful dynamic system that is generating the information that we need. But it's not about the technology. It's about saving lives. It's about reaching those that possibly are affected or infected as quickly as possible and getting them out of harm's way. This is about protecting the citizens of North Dakota. This is about staying in front of COVID so we don't throw our hands up and just let our citizens fall into harm's way. So that's the first part. D365 is like the heartbeat. It's the infrastructure of tracing. So the next piece is trying to do a better job and to innovate and automate a very important part of the tracing strategy and the testing strategy, and that is these public events that you're seeing around the state, staffed by Army National Guard, Air National Guard, public health officials, trying to reach out to the citizens to make that testing accessible for those that want it. I will tell you that working with the National Guard and watching the logistics of what it takes to test 1,100 people in one day, 8 lanes of traffic, 60 guardsmen on the ground, public health people, and the citizens of North Dakota working their way through that and never having to wait more than 10 minutes. That's serving the population. And so the reality is, though, those testing events, although they've improved and they're improving every time we do one, they are largely a manual event. I mean, we have guardsmen and public health officials with clipboards and 3-part forms. It's been a long time since we've seen a 3-part form. But we're using it. It's manual. It's getting the job done. And we're looking at that and saying we have to be more efficient. We have to make sure that the citizen experience is good and that we're getting them through and we're being efficient with that. And so this morning, We stood up a brand new system that will be beta tested this weekend. We are calling it Citizen Registry. And it will allow the citizens to come to a testing facility. In some cases, if they want, fill out their demographic information before they even get to the site. Have a QR code, just like when you're boarding an airplane. Show that QR code to the guardsman or public health. That contains your demographic information, and you go right into testing, and you get out of there, and you get on with your life. All of the clipboards, all of the three-part forms will be set aside, and the guardsmen and public health officials will have iPads. And that's how the system will be, the information will be entered into the system. That follows the specimen to the lab. The data digitally goes to the lab, follows and picks up those results, moves on to contact tracing, moves on to the public health department's data systems, and we do that without any manual intervention or without any other keying. I was talking with General Schulte about this as we were watching it roll out this morning, and feel pretty comfortable that in these events, these testing events, that we will be able to conduct those events with half the people that we do today. And that's important for efficiency. It's important for being good stewards of the resources that we have here in North Dakota. So the engine, D365, that's the heartbeat. The automation of the testing events, that's an important part of serving the citizens. And the third part is something that we've talked about, and the governor has mentioned many times from this podium, and that is Care19, the app. This is so cool because this is a North Dakota app. This is developed by North Dakota folks. Proud crowd out of Fargo. Tim and Darren have done an amazing job, and their team. One of the first in the nation to release an app like this. And the app is dynamic, and it's changing every day, and it's improving every day, and a new version just came out. It's on Apple, it's on Android. They are tightening up the location information. And it's amazing to see that we have 30,000 people that have downloaded that app. I just looked, and we're just a tish under 30,000. I'm here to tell you that's not enough. I'm here to tell you if we're not capturing more of this data that supplements our contact tracking system, it will be more and more difficult to stay in front of COVID. We don't need 30,000 to download it. We need 200,000 to download this app. And we ask ourselves, why haven't more people downloaded it? We've got over 700,000 now. Not everybody has a smartphone. Why aren't they downloading it? You know why. I know why. It's the 800-pound gorilla in the room, right? People are saying, oh, location data. There's a conspiracy theory. There's someone that is trying to get my data. I understand those concerns. And in a lot of cases, they're legitimate, but let me assure you that this initiative is not nefarious. We are doing everything we can to pull every bit of technology out of the bag to make sure we're gaining the data that we need to protect our citizens. It's that simple. You opt in for the app. You can load it or you don't have to. You can turn on location services, or if you're out and about and you don't want your location tracked, turn it off for a period of time. Think about Care19 as an insurance policy. I hope none of us have to use the data in Care19. Because when you do need the data, it means that you're positive. And let me kind of think through that scenario, right? A contact tracer calls you. You've been at a testing event. They call you. And they say, I'm sorry to inform you, but you have been tested positive for COVID. It's a call none of us ever want to get, but it's a call that 1,000 North Dakota citizens have gotten from the Department of Health. Now think about yourself in that position. your mind is reeling, right? What about my kids? What about my family? What am I going to recover? What does this mean financially? You've got all of that anxiety, and the next question from the tracer will be, now, can we talk about where you've been for the last 14 days in detail? Some of these calls take 2 hours. And you are in no state of mind to remember thoroughly, right? Think about how cool it would be at that moment if you pull out your app and say, let me see, and the app gives you the locations. You can just relay those to the caseworker while you're reading your app. You don't have to share the data, but if you want to share the data, we will allow you to share the data with the Department of Health. It will be augmented into your record, and it will be an important part of contact tracing. It's like putting together a 1,000-piece puzzle, and you get to the end and there's 2 pieces missing, and it's so disappointing. That's the life of our EPIs. That's the life of our contact tracers. They're trying to put this puzzle together. They're trying to connect the dots of this spider web of COVID. And when there's a couple pieces missing, it makes it that much more difficult to be efficient. It's a life insurance policy. Hope you don't ever have to use it. Hope that someday we feel comfortable for deleting the app and deleting the location information and we move on. The governor talks about individual responsibility. And I don't know about you, but if I was in that place of being positive and I forgot that I went to a certain place, or I forgot an individual and I didn't share that with the tracer, and for some reason that fell out of our contact tracing system and we weren't able to identify perhaps a vulnerable person or a family member or a place that we had been, and someone else gets COVID because we were neglectful in relaying that information, we would feel terrible. No one wants to be in that position. Please download the app. Help us build an effective app. Help us put that final piece of the puzzle together so that we can do an adequate job of contact tracing. I'd like to end with just a bit of gratitude. Governor Burgum, thank you for your clear, very concise directions. It has allowed us to keep our heads down and hopefully meet your expectations. In my career, I've had an opportunity to be a part of a couple of teams that have stood up large IT systems. D365 and the citizen registration are large, complex systems. I'm telling you that these systems are going to take 6 months to 9 months to stand up. NDIT and Dwayne Schell and his crew stood them up in a couple weeks. And the quality is phenomenal. And the training was complete. And the users are off and running none too soon. The National Guard, General Dorman and General Schulte. I've worked with some amazing people in my career, but I will tell you that being embedded with the National Guard, working shoulder to shoulder with them, has been one of the most profound experiences of my professional career. The Department of Health, Mylin and her staff, the contact tracers, the profound shift that they have to make with a brand new system, the lab going from 200 samples to 2,000 and beyond. Absolutely incredible dedication. Chris Jones in the Department of Human Services, the contact tracers, you know how I feel about them. And most of all, the citizens of North Dakota. You know, in a perfect world, we would have had these systems stood up and ready and tested and people trained, ready for COVID-19. We didn't have that luxury. These systems were put together on the fly rather frantically, and I'm being honest with you. But you should be very proud of the individuals, the employees of the state of North Dakota who have worked very diligently to proceed with a smart restart, of having the facts that we need to proceed with facts, not fear, That has been our charge. And Governor, it has been a privilege to work with you in this regard. Thanks.
Thank you, General Schulte, and thank you, Vern Dosh. We're at the dream team there of a brigadier general and a IT CEO working together. That's my dream team, and they're getting it done. As we've said, North Dakota's leading the way on testing and on contact tracing. They're going to both stick around for questions afterwards. Let me give you a quick update on Vision Zero. This is a reminder as we go back towards getting back to more activity, more interaction, more travel. As summertime comes around, as we head into spring work for farmers, more people on the road. We've talked about, we know that we had a huge drop of actual traffic usage in our state. In some cases, that we were down 30 to 40% on the counters across the state in terms of amount of traffic. Gasoline consumption in the United States has not been this low since the 1960s. That's not good news for the oil industry, but it is an indication of, again, of this tremendous demand drop. We have put out a vision of having 0 traffic deaths in North Dakota a couple years ago. We did this with the Department of Health. We did it with the Department of Transportation. We did it with the whole of government approach. And we've had great support from these agencies and great support from the North Dakota Highway Patrol and local officials. The reason why we say this, because we know that Vision Zero stands for the idea that any traffic death is one too many. When we've asked the question, how many traffic deaths do you think there should be? To ask that to any individual, they might say, well, we should have less than we have now. And then if you say, well, but what if it was one and that one was a loved one of yours? Would that be acceptable or would that be too many? The answer is always that that would be too many. If it's a son, a daughter, a sibling, a parent, a friend, that's one too many. And sadly, in our country, we have some years close to 40,000 traffic deaths in our country, many of them caused by impaired drivers, many caused by speed, many caused by people who aren't wearing seat belts. But there is, with today's technology, both through education, through being able to call businesses like Uber and Lyft for a ride home, there's all kinds of ways where we can really reduce traffic deaths in North Dakota. And again, we bring this up in part because we had planned to have it on the schedule to talk about here during the time of reopening. And as we close the calendar of 2019, just 2 years after the launch of Vision Zero, we had 100 crash deaths in 2019. That was our lowest year in 15 years. And so that was very exciting. And we were off to a great start this year. But however, this past week, sadly, there have been 3 motor vehicle crash deaths and some other serious injuries, which, as you know, has been reported recently. And again, our hearts go out to those families, and our prayers are with those that are in recovery. But this is, again, significantly less than the same time last year. Last year we were at 23 versus 13. I'm sure this is one of the side benefits of people having less physical travel during this time. So again, perhaps this year we can set a new record by the December 31st of fewer traffic deaths. But again, 13 is not 0. 13 is too many. And anyone who's lost a loved one this year will, I'm sure, share that. Again, 2020 crash deaths, the 13 we've had this year, same as before. Lane departure, no seatbelt use, excessive speed, or driving under the influence. When we take a look at what's gone on during this time frame, North Dakota Highway Patrol reporting an increase of speeding citations of 38% compared to a 3-year average during the same period. Apparently, the idea that there are a few people are on the road got people excited about driving faster. But again, as people come back online, as our bars and restaurants open again, we want to make sure that everybody's observing speed limits, wearing your seatbelt, and driving in a way where you're not distracted. In late March, one of our North Dakota State Troopers, North Dakota Finest, in the Minot area initiated a traffic stop on a vehicle traveling 136 miles an hour. The driver was subsequently arrested for DUI. Thankfully, the driver was stopped and removed before anything catastrophic occurred, but this is a great example of our North Dakota Highway Patrol staying committed. During this ongoing emergency, troopers have remained committed. They've been on the road patrolling every day. In addition to carrying out their regular duties, we give a shout out and a thank you to the team members of the North Dakota Highway Patrol. They've played a critical role in the state's response. They've participated in the transportation of test kits and PPE slides. They've collected tests back to the state when we were trying to speed up transfers. And as part of our North Dakota Smart Restart, the Highway Patrol will have extra patrols beginning today and through this weekend, May 1 through May 3rd. Again, so if you're going back out to enjoy the reopening, know that you'll be joined by increased patrols from North Dakota Highway Patrol. And again, if you do choose to consume alcohol this weekend, take personal responsibility, find a designated driver, and find a sober ride home, or call Uber or Lyft, or call a friend. 42% of North Dakota motor vehicle fatalities in 2019. Last year, 42% of that 100 were alcohol related. We need to make sure that North Dakota drivers and passengers are also North Dakota smart, make sure that lives are not lost to motor vehicle crashes. And again, when we talk about motor vehicle fatalities, that also includes, sadly, some pedestrian and biking deaths, because included in this are when we have car, pedestrian, or car, bike accidents. So again, as spring is out, we're going to have more people walking, more people riding bike. Make sure, in addition to wearing your seat belt, having appropriate child passenger seats, drive distraction free, which means, again, take a break from your cell phone, driving sober, observing speed limits. Every life matters, vision zero, which means zero fatalities and zero excuses. And again, thank you to the DOT, who's looking at areas around the state for road improvements to make intersections safer. And we're working in discussion with our tribes and with local officials around the state to identify those areas and change those and fix those, including roundabouts instead of four-way stops. And thank you to North Dakota Highway Patrol, who's always working to make sure that everyone's safe on our roads. Next topic, unemployment numbers. Yesterday, Thursday, regular claims 638. Today, under the pandemic unemployment assistant claims 225, pandemic emergency unemployment claims 169. So a little slower day yesterday, which is great news. Total regular claims since March 16th, 68,471. Total PUA claims since April 4th, approaching 9,000. That's 10,099.42. And the pandemic emergency unemployment claims, 10,623. Next topic is behavioral health update. And as a reminder, behavioral health resources, services, and support, they're available across the state. We've got more and more folks that are delivering behavioral health services through telehealth, and telehealth through changes with federal reimbursement is now not only more accessible, but also more reimbursable than ever. The Disaster Distress Help Hotline is a 24/7, 365-day-a-year hotline dedicated to provide immediate crisis counseling for people who are experiencing emotional distress related to any natural or human-caused disaster. Stress, anxiety, other depression-like symptoms are common reactions. And again, call 1-800-985-5990 or text TALK with us to 66746 to connect with a trained health counselor. Visit behavioralhealth.nd.gov for resources, find services and support, and for age-specific resources about talking to kids with COVID-19 and ideas to help maintain positive youth behavioral health and activities to do as a family. This weekend, there's many great ideas out at parentslead.org. And again, if you've got any kind of stress or anxiety right now, go ahead and call the disaster hotline, whether it's financial stress, weather stress, farm stress, income stress, job stress, health bill stress. Give them a call. They'll be ready to talk to you and help connect you with resources. It's all confidential. And lastly, under the good news section and the gratitude section, May 1st is not only Arbor Day and May Day, it's also May 1st is a school lunch hero day. We talked earlier about the important role that K-12 plays, their staff and the educators in caring for our children, but we're grateful also to our school lunch heroes, the cooks, and all those that work in food service, those who serve, who care for the nutritional needs in and out of school. And during the normal year, when we take all the districts, including public and private, hard to believe it, again, these numbers, 28,000 breakfasts are served each day, 87,000 lunches per day. And during this COVID closure, there are still 170 districts have continued to serve now even more, increased number, 44,600 breakfasts and lunches each day for a total of 89,200 meals a day. That's been going on this entire time. So again, we want to give a shout out to all the individuals who, in light of this COVID emergency, have rethought, redesigned the processes, how lunch and breakfast is served, and continued feeding our students in a very different distance learning environment, because we know that if you've got an empty stomach, it's hard to fill your mind. And so again, thank you for taking care of these important needs. And lastly, Superintendent Baszler talked about next week is Teachers' Day, and today also happens to be National Principals Day. So as a former principal, to Superintendent Baszler and all the principals across the state, of all our elementary and secondary principals, we say thank you for your leadership at the building level to help navigate through this incredible time. And lastly, a moment of thought on gratitude as we close out for the day. Robert Holden had said the real gift of gratitude is that the more grateful that you are, the more present you become. And I think this is a present to yourself, because the more present you are, you have an opportunity to understand and look at with awe and wonder at the incredible things that humans can do, even as we go through some of the most challenging times in our history. And so again, the more grateful you are, the more present you come. The more present you are, the more you can appreciate everything around you. So again, with that closing thought on gratitude, thank you to all the presenters today. We'll stand for some questions. Jacob edged you by a minute, Jack, so we'll go to you next, and then we'll come to this side.
Governor, you announcing that schools will remain closed for the end of the year, the same day that many businesses are opening back up. You mentioned that schools have the potential to be a hotspot as part of your logic, but Main Street is reactivated earlier today. Wondering where the logic is and the consistency.
Well, some of it has to do with economic risk, and some of it has to do with what we talked about today from the testing and contact tracing and the capability. We are in a position, based on our healthcare capacity, using less than 2% for hospitalization, we can dial up more risk. And by opening up businesses who are economically impaired because we mandated their closure is a way to help relieve stress and help get that part of the economy going again. As we said, with distance learning, teachers were getting paid, administrators were getting paid, there was no economic risk. But the contact risk of 120,000 school kids and 16,000 teachers and administrators all entering back into buildings, perhaps traveling there on a bus, where they've got close contact on a bus, you've got close contact in a classroom, cafeteria, and gym classes. And so then we were going through that. If we reopened, how would you do this? Would you not have busing? Well, then that creates a huge burden, because you can't, hard to have busing. You know, do you have kids separating separate on a bus? Well, then who doesn't get to ride the bus? Okay, we're going to have school, but we're not going to have gym. We're going to have school, but you got to bring your own lunch because we don't have kids in the cafeteria. Pretty soon school doesn't look like school, and pretty soon all the effort of the administrators in the last 3 weeks of school are going towards trying to manage distance in an educational environment not built for distance. And so we would much rather again, create that certainty for teachers, administrators, and school boards. They can pour all their energy into making distance learning great, make it better every day between now and the end of the school year, and think about summer school, acceleration academies coming back next fall, because we would have burned, I think we would have burned up every ounce of energy trying to figure out how to get back into schools as opposed to putting our energy into educating students. And so I think that was a key part of it. The other piece, as we said, is we're still very concerned about vulnerable populations, and we've still got some concerns about some part of our state. Today with 40 new cases, 29 of those were in Cass County. We had a high percentage yesterday from Cass County. Over 80% of the actives cases in North Dakota are in Grand Forks and Cass County. We've got 17 of the 29 long-term care facilities in the state that either have a positive from a healthcare professional that works in one of those facilities or a resident. Those are in Cass or Grand Forks County. And so we know that we've got to deploy additional testing and contact tracing efforts at Cass and Grand Forks right now. We need to do that. And if we're trying to, again, build up our testing, build up our contact tracing, tackle areas that we want to slow down, and then at the same time, we open up not just 175 school districts, open up 500 and some buildings, and then have an outbreak there. We'd be trying to make a trade-off. I mean, do we go test everybody at the long-term care facility, or do we go do testing at schools? So if we had unlimited capacity for testing and for contact tracing, then you might have made a different decision. But we don't have that right now. By next fall, we should have a whole new array of testing capabilities, because by next fall we should have antigen and antibody testing. We should have thousands of more tests per day. We should have the systems that Vern talked about will be up and running. And so we'll be able to, the risks will still be there about bringing the schools back, but we'll have much more ways to mitigate that risk. And by that time, we will have tested everybody in long-term care. We'll have better ways to control and protect the healthcare staff that works in long-term care. So it was about economic risk and health risk, and there was a lot of economic benefit. So that was the things that we weighed. Jack?
Two questions for Vern, if he doesn't mind.
I would love to have Vern answer some questions. Welcome back, Vern.
So just want to make sure I have my numbers right first. 352 people trained on contact tracing so far in North Dakota, and how many of those are active?
Jack, active contact tracers right now is 77.
The Care19 app, what are the plans for using that tracing data? Has that been put to use yet?
So you have the ability today, if you look at places on the app, where it will list the locations you've been. So you have the option to just verbally share those with the tracer as you're in that conversation with them. The functionality that literally we're working on today, and that hopefully will be delivered by Tuesday, Wednesday, is the option to, when the tracer is talking to you, they will say, would you like to share your data? You don't have to. It's optional. If it's easier for you just to give them your locations rather than you painstakingly stepping through it, you'll have the option just to basically hit a button that will download that. That will be augmented to your file as a case that is being traced. And then, the epidemiologists and the tracers then will use that data to try to connect the dots that you saw, trying to identify possible other people that have been exposed, or locations that could be a hotspot that need attention, or things like that.
So we're working on the functionality you said to get to the point of, people being able to opt into their tracing data being used.
Yes, sir. It's there today. I mean, it's in the app. It's being recorded. If you are using Google Maps or Apple Maps or Strava when you do your workouts, or GolfSpot when you're golfing, you're using the location services. There's a number of them that you're already using today if you have that turned on. And this is just an option to make that a little more thorough in terms of gathering where you've been for the last 14 days. And you, as a citizen, have the option to, just to keep it and to relay it verbally, or you will have the option in the next couple of days to be able to just say, you know, here, take my data and you sort through it, whichever is easier for you.
Is that Crowd that's putting that functionality together?
Yes, sir. Proud Crowd is adding that, and there is an interface going on with NDIT where they will bring that information directly into the D365 system.
Thank you.
Thank you.
I just want to reaffirm on Jack's question on this thing that is completely voluntary if anybody wants to download their data into the D365 system that Vern talked about. And again, when you use Care19, you're not required to enter your email address, your phone number, your physical address. You're assigned a 36-digit random ID number, and it is completely anonymous. And so it's completely in the user's control. North Dakota Department of Health does not have your location data. The state of North Dakota doesn't have your location data. We're not interested in it. We're interested if you want to share it to aid in the contact training on a voluntary basis. If you're interested in doing that, that could help save lives. But we are not, the state of North Dakota Health Department is not collecting location data on individuals through this app.
But it is a requirement of the order of the state health officer to participate in helping state and local health authorities with contact tracing, correct?
It is, and you can do that through trying to remember where you've been the last 14 days, or you can use this as a memory aid, and then you can just over the phone share where you've been, perhaps more completely, and that will help save lives. The other benefit of, when Vern's talking about this being a life insurance policy, is what I'll call exposure notification. We don't have to know who you are. If we had, 30,000 people, and we find out that there's a hotspot that's coming from a bar, a church, a restaurant, let's say it's next September, we could go into the location data without knowing who the individuals are and say, we want to send a push notification to anybody who's been in that location in the last 2 weeks to notify them that they may have been exposed. So they could get an alert, but we don't know who we're sending it to. And that exposure notification, again, is one of the things that Apple and Google are working on together. And I know that in the design plans, again, it's about protecting people's privacy and saving lives. We're doing both of those things simultaneously. This whole app was designed around protecting people's privacy. That was the design point at the beginning, and I think it does a fantastic job of that. And again, with more people using it, you get a chance to save your life, your loved ones, others around you, and maybe strangers you haven't even met, because if you're asymptomatic and then find out one day you're positive and you've been in contact with a lot of people, particularly now as we're opening up, more important than ever that people download Care19, take control of your own data as you do, and share it when it's useful to make a difference. And I also think it automatically deletes after 30 days. We're not trying to build files of where people have been their whole lives. What we're interested in is where you've been in the last 14 days. So I think that the data is all deleted after 30 days. Jacob? No, I'm sorry, I'm going online and then back to Jacob. Online?
April Baumgarten, former Fargo Moorhead. North Dakota United conducted a recent survey in which about 90% of teachers said they'd feel unsafe returning to schools, and the union has also said that distance learning in North Dakota has been the envy of the nation and it would be detrimental to discontinue. How much did teacher input play a role in deciding to continue distance learning?
Well, we can't teach without teachers, and so that input played a very significant piece of that. Of the input. So was familiar with that survey. Really appreciated the partnership we've had with Citizens United and the leadership there, Nick and the whole team. So anyway, we're love to have we're always great to have their input. But of course, it's also school boards, ultimately the ultimate governing authority. So a lot of contact with them, school administrators and parents. Because teaching from home puts an additional burden on parents. So we really tried to make a holistic view of that. But again, it really evolves around teachers, and so that was a key piece of input. Jacob? And then Lane after that.
Either a question for you or for the state superintendent, but in a letter to parents and students from Valley City Public Schools, the letter references that they were given a draft of recommendations and guidelines for the possibility of reopening just a few days ago. Wondering what those options or guidelines were.
Well, I can maybe take this one if you want to, but through the K-12 Coordinating Council and through our office, we had been working with ideas about possible reopenings, and whether that's summer school next fall. We got to start thinking about what a new standard operating procedures look like. So there was a lot of effort put into the effort to try to figure out what do you have to do from a health standpoint to reopen, and the enormous effort that would take, and then what you would have to do if you had a positive case, and the cost of disinfecting schools. It was a fantastic exercise to go through that, and we did circulate it out. I know some folks, including members of the K-12 Coordinating Council that were involved in different school districts, saw those early drafts. We wanted to get input from them. I don't know how widely some of that may be shared, or if that was a Valley City's own version of that, but I think that was another factor, because we could have spent all of our energy at the building level and the administrative and school board level trying to deal with health risk, and I think the kids would have been missing out on the opportunity to have even better and better distance learning happening over the next 3 to 4 weeks as we head to the end of the school year, because that could have been a gigantic distraction. But we have to keep working on those plans, because we have to work on how might we do summer school, how might we do, get back in the buildings in the fall. So that work will continue. Is that fair enough, Superintendent? Okay. Lane, and then online.
Governor, I was going to ask this to Mylene, but it seems as though she stepped out. There's been some reports that some doctors saying that we need to go back out into the world to build our immune systems, because staying at home might hinder that. Thoughts on that?
Well, I think certainly I've read a number of those articles, and this is why I think we're in a good spot in North Dakota, where 93% of the jobs in North Dakota were either open or eligible to stay open when we kept open all of energy, all of agriculture, all of manufacturing, all of construction, all of healthcare, including elective surgery, and all of education. All that was happening from a distance standpoint. And so we are taking on some additional risk by reopening, and there'll be more transmissible moments even as we're practicing COVID etiquette this weekend. I'm sure that if people get back into bars and restaurants, and we're working hard with the business owners as customers, employees, to keep their distance, we are dialing up some risk, and with that, we may see that there may even be some case increases that start to come, but it was not about trying to keep cases to zero. It was trying about how do we have the fewest number of people that pass away from this, which means protecting our most vulnerable, and it means protecting our healthcare capacity. And so we're going to continue to protect healthcare capacity and protect our vulnerable, even as we take on more risk, or as we say, or as others might frame it, take an opportunity to build more herd immunity, because that'll be what's happening. So I feel like we're on that path. We were never ever shut down, shelter in place like other states were, but now as we open back up, there'll be more transmissible moments that are occurring. As we've said, a couple of things. If you're over 65, you've got an underlying health condition. If you're in a vulnerable population of any age, we advise people to just maintain extreme caution, because the virus is still there. We'll go Jack, and then online.
What does the announcement today, Governor, mean for spring sports as well as summer activities like softball?
Spring sports are all guided by the North Dakota High School Activities Association, and I know that they'll be, I'm sure they were waiting or watching or looking at what we were going to do, but again, they'll independently come up with that answer. And then summer sports that are, if it's a softball, I mean, as someone who enjoyed Park District amateur basketball for about 40 years and softball for about 30 years, I'm sure people will be anxiously waiting to find out if those leagues are operating again. And I think that would be up to individual park districts in terms of how they think they want to do that. I know that Legion baseball and other summer sports are governed by the Legion, and I think people are trying to figure out a way to figure out how to make that happen. And again, we encourage innovation and safe innovation around that, even if that might involve people having an opportunity to play, but limits on spectators. But again, we're open to hearing innovation around that, around all those ideas. Okay. If you didn't hear that, the North Dakota High School Activities Association was actually meeting at 5 o'clock today, waiting to hear what we're doing today. So maybe there'll be more news on that. Online question?
Can I I do a quick follow-up to that one, and then I have one for the superintendent.
Okay.
So similar to with sports, large gatherings such as fairs and softball tournaments are on hold right now. Do you have an expected timeline on when a decision to allow those might happen? And this is from Gene Shemp, Hometown Radio Group in Minot, and Matt Henson of WDAY.
They teamed up on that question, Gene and
Each
Matt?
asked almost the same thing.
Same thing, okay. You know, we've been tackling the most urgent, biggest decisions we can. I mean, this week with the budget guidelines, K-12, and reopening's been a big week in terms of decision making. That'll clear some space in our ability next week to start looking at fairs, large events, and other best practices that might accompany those. So I would expect in the next week or two we'll have answers on that. I mean, I know that somebody that went to McQuaid's every year for a long time, people would probably want to know when are these big softball tournaments happening. Very hard to have those and have them be effective without having crowds. So some of it's going to depend on the numbers we see in the next couple weeks, and part of what we see in the numbers in the next couple weeks is going to depend on what this amount of interaction and transmissible moments that we've interjected back into the economy starting today. It'll take us a week or two to start seeing results from that. So I would say that in set expectations, I have in other formats said to think about this in 2-week increments in terms of when we would open up. That's not necessarily when we'd give guidance, but it's going to take us about 2 weeks to know how much, whether we took on the right amount of risk or not with this level of interaction. Okay, Superintendent Baszler, question?
Williston trending topics. Williston District 1 Superintendent Jeffrey Thake has been a trailblazer in innovative learning and distance learning. How did his aggressive attitude towards innovation and distance learning help your offices in the past several weeks in implementing the current plan? And have you had any surprises in the implementation?
So the question was, Williston School District number 1 is a trailblazer in innovation education. Dr. Jeffrey Thake is the superintendent up there. Tremendous great ideas, very supportive staff, very progressive staff that is always looking to do things that's in the best interest of their students and families. So the question was, how has that impacted or influenced the work? So yes, Dr. Thake is leading a great team of teachers, educators, family, community, and thinking about the way that we're delivering school differently. He did that very well. The team of the whole school district in Williston did that very well. As the governor mentioned, there is school districts like Williston that we're so proud of and we lift up all across the state, and those that may not be as bold and as prominent in those efforts, there are those success stories all across the state, and I think that's what has happened through this COVID-19. If we can think of things that are a positive that have resulted in this, I think the result has been the opportunity for us to really highlight, lift up all of those wonderful ways that we are doing education differently. And I think I've said this before, I've said this probably for the last 7.5 years to many of you. The world is no longer rewarding our young people for what they can do with information or knowledge, or what they know about information and knowledge. The world is only rewarding young people for what they can do with it. And so I think Williston, I would hold up many, many others across our state that also do those things. They are teaching our students not only what to know, but what they can do with what they know. So I think as we look forward into life after COVID-19 and education after COVID-19, I'm very excited about what education will be and how our students will be able to do things with what they know. What has surprised me during this whole pandemic, I guess the last 9 weeks of school, as we finish out strong the last few weeks of school across the state, what has surprised me is the strengthening of our partnership between home and school, and the way that our partnership has been strengthened and amplified on how important it is for our families to have that teacher in their life, and how important it is for teachers to have that family support in their life. And so not a surprise, but I guess an opportunity for us to really just celebrate that, because I don't know that that's the way that it is in every other state in the nation or every other community across all of the world. And so that hasn't been a surprise so much as it is a reason for us to celebrate and really I guess, as I say, amplify that even more. What has surprised me, I guess, would be the way that our families, our students, and our teachers, and our school boards across the state have come together and really not just said the words, we're all in this together, but really demonstrated that. Tomorrow, I will have another meeting with my family cabinet. We've been, as you all know, I have a family cabinet, a student cabinet, and meet with the administrators, elementary, secondary principals, and of course our local superintendents. And I've been meeting weekly with school board members every Wednesday night. What we are beginning tomorrow is we've developed a PK-12 alliance with members from all of those groups that I just talked about. And what we're doing is planning on how not only are we going to get through this pandemic together, but how we will leverage what we've learned during this COVID-19 to make us a better state in K-12 education moving forward. Thanks.
Last question? You say last call? That's later tonight, probably, right, with the B.
Yesterday, you had mentioned, you had talked about testing all long-term care facilities by May 9th. Is that still the plan? And how does the state plan to accomplish that?
Do you want to have a...
We have 79 testing.
Come on up. Question was, how are we planning on testing all long-term care facilities, that's residents and staff, before May 9th? Here's Brigadier General Schulte with the answer.
At this time, we have 79 long-term care facilities tested, and so that would leave 139 to go with over a week. So we have planning in place as far as that guidance and prioritized long-term care. So we're on track.
Short, accurate answers. That's why you got generals helping you out. Like that, we're on track. Okay, closing out for Friday. Again, as we celebrate all the great things about North Dakota, I want to thank all of the folks here that have tuned in. If you're listening today, if you're watching this, if you're in the media that was here, if you're in the media and you're here also earlier today for an hour and a half earlier on the budget stuff, thank you for your diligence. Thanks for all the media that are dialing in online and asking great questions. Thanks to all the team here that is helping on getting this communication out. And I want to say a shout out to all the citizens in North Dakota as we enter into this beautiful North Dakota weekend. All the farmers that are either in the field or hoping to get in the field. Just want to say thanks to everybody for their great work during this. It's been a team effort, Team ND, the whole state working together. There's been so much North Dakota Smart activity happening at every level, whether it's in health or in education, transportation, in government, at the city, local, township, county, school board level. A lot of great things happening, park district level. So again, way to go, North Dakota. We're doing great. Be safe this weekend. And for those here, we'll see you Monday at 3:30. Have a great weekend.